So what are we talking about here? Right?
Benzodiazepines are wildly overprescribed and have been touted to physicians as cure-alls for anxiety, sleep disorders, and addiction problems. Less commonly known to physicians are the symptoms of withdrawal that occur from dependency to benzos, as they're commonly referred to. These symptoms are inevitable and come on quickly when someone has been taking these medications for any extended period of time over 30 days. Symptoms of withdrawal include convulsions, disturbed sleep, feeling nervous or tense, confusion, depression, paranoia, panic attacks, anxiety, feeling distant or detached from people or surroundings, sharpened senses, noises seem louder, colors take on a different hue, and of course, shaking. In many orthopedic cases, standards of care call for narcotics prescriptions and a 6-week follow-up or orthopedic consult. Insurance companies are gambling that people will forego surgeries and treatments in lieu of narcotics prescriptions written in perpetuity and refilled without so much as a red flag by insurance carriers. The average person has dependency issues after 30 days of narcotics use. The extra 2 weeks is merely icing on the cake, sealing up the cracks, cementing the problem. This whole scenario is a win for insurance because narcotics are cheap, and many people lose their will to continue seeking treatment while becoming dependent on the drugs. They lose their jobs. It's actually rather difficult to stay employed while addicted to narcotics. Once the patient has lost their job and are no longer covered by their employer's plan, or they can't afford coverage, they can no longer seek out surgeries or therapies and have no alternative but pain management. This ensures that no company will ever have to pay for those needed surgeries or treatments because the patient has now been labeled with a pre-existing condition and in some cases, a lifetime rider. Yeah, that sounds kind of like a housewife and a cowboy. Never mind. The simple fact remains that no insurance company will ever have to pay for that injured person to receive surgeries or treatments that may bring them back to full rehabilitation. They will, however, pay for narcotics.